The number of children accidentally swallowing nicotine pouches has jumped in recent years, and that's according to a new study. Data published in the journal Pediatrics found there was a more than 700% increase of cases where children under 6 ingested nicotine pouches between 2020 and 2023. Joining us now is Natalie Rine. She's the director of the Central Ohio Poison Center at Nationwide Children's Hospital. Natalie is also one of the co-authors of this new study. Natalie, thanks so much for being with us. First off, let's talk about just how significant this jump in cases was when you hear 763%.
Thank you so much for having me. Yes, it is a pretty significant increase. When you look at the rate of ingestions per population, that was the number that we calculated, 0.48 in 2020 to 4.14 in 2023. So a pretty significant increase.
Of course, this goes hand in hand with the sales of these pouches going up. The Journal of the American Medical Association tracked the rise of nicotine pouch sales. It showed overall sales increased from 126 million units from August to December of 2019 to 808 million units from January to March of 2022. And you can see that on your screen right there. So what do people need to be on the lookout for that might signal their child has ingested one of these pouches?
Some of the early signs and symptoms of nicotine toxicity, with lower doses, you see nausea and vomiting, but with more significant ingestions, you start to see things like increased blood pressure, increased heart rate. And if severe enough, you can see symptoms like seizures, respiratory failure, or difficulty breathing, and sometimes as severe as coma.
If that's the case, then, Natalie, what should someone do if someone at home believes that one of their kids might have taken a nicotine pouch?
One of the first things you can do is please call the National Poison Helpline at 1-800-222-1222. Your local regional poison center is staffed with specially trained nurses and pharmacists that are well equipped to handle these sorts of calls. They're ready and willing to help you decide can your child be safely watched at home, or does it sound like they have symptoms that are severe enough that they should probably go seek medical attention? So we're there 24/7, 365. Just give us a call and we're happy to help.
Yeah, every minute can count in something like that. Natalie Rine, thank you very much.
Thank you. Thanks for having me.